To help us analyse the current situation in Gaza, we're joined from Geneva by Margaret Harris, a spokesperson for the World Health Organization. Thank you so much for joining us.
It's a pleasure to be with you.
Let's start off with the Director General of the WHO's remarks, where he said the situation unfolding in the north of Gaza is apocalyptic. Can you sort of describe the current humanitarian situation in Gaza, especially in light of the recent attacks that have happened in Jabalia, given the number of kids that have died in the last 48 hours, in addition to obviously, the north of Gaza itself being cut off completely from humanitarian aid?
So the children of Gaza have really had their future, their lives hijacked by this conflict. The children, particularly in the north, are facing continual bombardment, but also starvation. It's very, very difficult right now to get any food into the north. It's very difficult to get clean water. It's very difficult to get medical aid. We did get medical aid supplies to the Kamal Adwan, which is a children's hospital in the north, and they were then hit in a subsequent bombardment. So those supplies were actually destroyed. And the doctors in that hospital say that they are very, very few doctors now, and they are trying to do surgery and anesthesia in the most difficult circumstances. Quite often it's doctors who don't even have that experience, but are doing their best to try to save the lives of children. The other thing that's really critical is the children are starving. We had what's called a severe acute malnutrition center at Kamal Adwan Hospital, but that's really not functioning. And yet we've got a huge numbers of children who are in a severe starvation. At least 60,000 children between 6 and 5 months are estimated to be suffering now from acute malnutrition.
Well, since you spoke about, attacks on the Kamal Adwan hospital, healthcare facilities generally in Gaza have been targeted by the Israeli army, including emergency services as well. In the north, there are a lot of reports when it comes to the emergency services and the hospitals that have been rendered non-operational or are not there at all. Like the emergency services can no longer go help the people under the rubble because they no longer exist. How does this sort of affect the situation in the north of Gaza? Do you think that this may lead to further deaths because of a lack of services?
It definitely is. It's not just a matter of will it. It's happening right now. That when you've got something that's continuing to create injuries and illness, the bombardments, plus the starvation, plus the crowding, the herding together of people, so you've got infectious diseases. Your need for medical care goes up and up and up. And at the very same time, all the attacks on health, the limitations on letting the supplies in, the reduction in the number of health workers means that there are fewer and there's less and less ability to meet those needs. So what that ends up as is many, many people, especially children, dying.
Yes. If we could sort of follow up on that idea, what is the state of the medical care in Gaza right now? And how are the ongoing attacks actually affecting the essential services, like the vaccination campaigns that have been interrupted due to Israeli bombardment?
So it's extraordinary that there's any medical care at all, given the relentless attacks, given the difficulties. I said, many of our missions to send supplies have been impeded. We've only been able to get 20% of the missions we've requested actually approved or actually go ahead. And so it's quite extraordinary that any care at all is happening. It is happening, that 16 of 36 hospitals are trying to function, but it's not functioning in the way you or I would understand a functioning hospital. We also do have field hospitals that were set up as this conflict progressed. There were 10 of those, but only 5 are partially functioning. There were also this what you call primary health care, and it's a lot of the primary healthcare workers who've been providing the vaccination. Again, many of those are closed. 70% of medications are just exhausted. I mean, they don't have it. So they've only got 30% of medications. We do have 14 emergency medical teams deployed across the Strip. But again, it's very hard for people to reach them and for them to reach the people. And you mentioned the polio vaccination campaign, which we are trying to carry out currently in the north. We've had to limit the places where we're doing it, and we've had to go from having fixed places where the parents can come with the children to relying on mobile teams. That's teams who go out and try to find the families and find the children, because that's the only way we're going to reach children at the moment. But it's very, very dangerous for those teams.
You talked about a number of different factors that affect, children in Gaza. Some of them obviously is the bombardment and the attacks by the Israeli army, but also there are other factors that affect the children's lives, including, the lack of vaccination for polio or other diseases like skin diseases or malnutrition and so forth. On the long run, what effect could this have on the children or the future adults of Gaza?
It's having a massive effect. Just think, there's been a year's worth of babies born in Gaza since this conflict began, and they've been born to mothers who were starving, mothers who could not provide food for these babies when they were born, have not been able to provide a safe and healthy space for them. The older children are living a nightmare, and they are living in terror. Every day there are bombs. Every day they see things that no child should see. Every day they lose people they love. Many of them don't even have family members. They're just simply on their own. Others are trying to care for them. Many have suffered horrific, life-changing injuries. We've got thousands and thousands of children who've lost limbs, who are going to struggle to be able to walk and function normally. So you've got an entire generation who've had the most horrific things done to them, and just simply recovering mentally, let alone physically, will be a very long, hard road.
You talked about the idea of the psychological effect on the children, in addition to the obvious disabilities that they may have due to, being attacked by bombardments or by the Israeli army in general. But, how has the recent attack on the Sheikh Radwan Healthcare Center impacted the vaccination efforts? And how will this affect the health of the children in the area in the future? Because polio is quite a serious disease. What does this mean for, the physical health of children there?
So polio is a very serious disease, and that's one of the reasons why there's been such massive efforts to vaccinate the children against polio. But there are many, many, many other infectious diseases that normally children would receive what we call the routine vaccination from birth. Now, it's been very difficult to reach children, especially those who've been recently born. I mean, actually, prior to this conflict, Gaza had one of the best records in the world. They had very, very high levels of childhood vaccination. So you've got the older generations who at least have had that protection. But again, this has been entirely disrupted by this conflict. So you've got children who've missed out not just on their polio vaccinations, but their vaccinations against measles, against respiratory diseases, against all the things that protect our little ones, allow our little ones to reach their 5th birthday.
Okay, thank you so much for painting the dire image there in Gaza. That was Margaret Harris, a spokesperson for the World Health Organization. Thank you for joining us, and thank you for your insights on the situation.